The Adjustable Gastric Band. Surgery starts by placing several trocars strategically in the abdominal wall. Once placed, instruments and scope are passed in order to visualize and mobilize the intra-abdominal contents. The normal flow of food passes from esophagus to stomach to the small intestine, where the food mixes with the stomach acids and digestive enzymes and absorption of nutrients takes place. The adjustable gastric band, often called simply the band, involves an inflatable band that is placed around the upper portion of the stomach, creating a small stomach pouch above the band and the rest of the stomach below the band. The common explanation of how this device works is that with the smaller stomach pouch, eating just a small amount of food will satisfy hunger and promote the feeling of fullness. The feeling of fullness depends upon the size of the opening between the pouch and the remainder of the stomach created by the gastric band. The size of the stomach opening can be adjusted by filling the band with sterile saline solution, which is injected through a port placed under the skin. Reducing the size of the opening is done gradually over time with repeated adjustments or fills. The clinical impact of the band seems that it reduces hunger, which helps the patients decrease the amount of calories that are consumed. The advantages include: it reduces the amount of food that the stomach can hold. It induces excess weight loss of approximately 40 to 50%. It involves no cutting of the stomach or rerouting of the intestines. It requires a shorter hospital stay, usually less than 24 hours, with some centers discharging the patient the same day as surgery. It is reversible and adjustable. It has the lowest early postoperative complications and mortality among the approved bariatric procedures. It has the lowest risk for vitamin and mineral deficiencies. The disadvantages include slower or less early weight loss than other surgical procedures, greater percentage of patients failing to lose at least 50% of excess body weight compared to other surgeries commonly performed. It requires a foreign device to remain in the body. It can result in possible band slippage or band erosion into the stomach in a small percentage of patients. It can have mechanical problems with the band, tube, or port in a small percentage of patients. It can result in dilation of the esophagus if the patient overeats. It requires strict adherence to postoperative diet and to postoperative follow-up visits. It has the highest rate of reoperation.